Thank you to all the speakers. Starting the session right now. Thank you all for coming to this session focused on achieving the Sustainable Development Goals through the Humanitarian Development and Peace Nexus, aka the Triple Nexus. This topic was recognized as a priority during the previous forum. The Sustainable Development Goals have an unprecedented scope. It's a plan of action for the people, planet, and prosperity. In 2015, the 17 goals were established and are aspired to be achieved by the year 2030. While the Triple Nexus refers to the interlinkages between the humanitarian, development, and peace actors, specifically, it aims for these areas to work together more coherently in order to effectively meet people's needs. This session is very timely, as we're witnessing an increasing crises unfolding globally and persisting conflict drivers. Furthermore, the SDGs have gone backwards due to the COVID-19 pandemic. According to figures, countries that are facing the biggest struggle in achieving the SDGs are in fragile contexts. And in 2030, more than 80% of people living in extreme poverty are expected to come from these fragile contexts. This fragility has transborder implications on a regional and global level. Today with us to discuss this critical topic is a distinguished panel of senior leadership, representatives, and experts from the United Nations agencies, funds and programs, Qatar Charity, and the Saudi Arabia Ministry. I have the pleasure of introducing them to you all. We have with us Mr. Peterson, the Assistant Secretary General and Deputy Executive Director of the United Nations Population Fund. Ms. Zaina Ali Ahmed, the Resident Representative of the United Nations Development Program in Yemen. Mr. Ahmed Saad Al-Rahimi, Director of External Affairs in Qatar Charity. Dr. Adham Abdel-Min'am, the World Health Organization representative in Saudi Arabia. Ms. Yara Sindi, the General Manager of Monitoring and Reporting for Sustainable Development at the Ministry of Economy and Planning in Saudi Arabia. Mr. Giovanni Cassani, Senior Advisor on Internal Displacement in the International Organization of Migration. And Dr. Hakim El-Wa'er, the Food and Agriculture Assistant Director General and Regional Representative in MENA. And I will be moderating this session. My name is Jude Wasal Al-Harthi, previously Department of Political and Peacebuilding Affairs in the United Nations and the Executive Secretary General Office, Rule of Law Unit. Now I will go around to ask our distinguished panel questions, but we will open it up to the Q&A session to the audience. If there are any interesting points that are raised that you would like to elaborate on, please take note of it so that you can raise that question during the Q&A session. Starting us off today will be Mr. Peterson. Can you please share with us what is UNFPA's value proposition in the Peace Nexus, please?
Yes, it'll be my pleasure. Thank you very much for the introduction, and thank you for inviting me to be in this panel. Thank you to KS Relief for their leadership and the government of the Kingdom of Saudi Arabia. This is very important, and I think it's very timely to have a bit more operational discussion in a way after the very good analysis we've heard this morning. We know that we are in a situation with many, many conflicts, increasing number. For UNFPA as an agency, that has also meant total change, or not total, but significant change in the way we are working. Last year, 45% of our non-core funding was actually for humanitarian activities, which is a huge increase just over the last 8 to 10 years. And we have talked about the Nexus for a number of years, and we tried to then make it into actual way of working. In our current strategic plan for the 2022 to 25 period, we have actually integrated our humanitarian activities as one of the strategic outcomes of the strategic plan. This is new. Previously, it was seen as something in addition to our long-term developed work, but now we have totally integrated it. It also springs from our mandate and what we call the 3 transformative results in our strategic plan: 0 maternal death for preventable reasons, 0 unwanted pregnancies, and 0 gender-based violence. If we look at these 3 results that we want to achieve with our partners, a lot has to be done then in conflict-ridden or disaster-stricken areas, because we know, for instance, last year there was around 121 million unwanted pregnancies globally, and 65 million were in refugee or internally displaced settings. We know gender-based violence increases with wars, with conflicts. So it's somehow in our DNA, you can say, in terms of our strategic plan and our goals. And then we have to deliver, and we're doing that internally by strengthening the capacity, integrating the analysis as well. But we're also doing it externally with partners, building upon the long-term relations, network partnerships in certain times of crisis. Afghanistan is an example, for instance, because we have been there for many years, 30 years, and we have worked and we are working with local family health centers in providing support for women and adolescent girls, in particular for reproductive health related and family health issues and child issues. And that network we have been able to use as the platform or the partnerships to scale up in terms of a sudden crisis that we saw. So we actually been able to maintain delivery of services for women, by women, and also to scale up based on the network we had. So I think this is part of the work that needs to be done. It goes for capacity building of our own staff, it goes for with partners we work with, and it goes also, of course, for the partnership within the UN family and within the broader international society and civil society. One last point, actually, we are working very much through implementing partners and very much through local organizations. That's where, as was also mentioned this morning, where you get the long-term resilience by building up the local capacity. And that's why we are focusing a lot, almost 40% of our work with civil society implementing partners is with local organizations, so we are able to scale up the capacity in a longer term and use that when we need to respond very quickly to a sudden crisis.
Thank you very much, Mr. Peterson. And what is the United Nations Population Fund perspective on the financing and funding mechanisms needed to strengthen the humanitarian development and peace nexus?
Yeah, first of all, more funding is needed, as has been underlined several times this morning, and as has also been underlined already, more flexible, more durable long-term financing is needed. More core financing to the organizations would be the best, because that allows us for actually very flexibly shifting when priorities or activities when needed. The COVID pandemic is an example of that. If we didn't have this institutional basis from our core financing, we wouldn't have been able to react so fast. But partnership, we are looking outside of the traditional. We are so grateful for all the support we still get from the we can say traditional donors, but we're also looking outside of there. We're working with the international finance institutions also to see how we can leverage. Our mantra in our plan is actually from financing to funding, to try to both do direct funding but also leverage. And I think it will it's on the way. And it's also needed. I think we have to talk to our partners, in particular government who are donors. The world is not divided into budget lines when catastrophes and conflicts happen. And we just have now the example, I think it was mentioned this morning as well, in Syria after the earthquake. I mean, if you want to address the needs there now, you have to do it also looking ahead and being in a resilient in terms of infrastructure, water and so on, but also houses. And how can you, in that respect, try to distinguish, was your house destroyed by war or was it destroyed by earthquake, right? Because we have different boxes, or maybe we don't have. So I think we need flexible funding, and we need the possibility actually of being able to shift priorities without losing the long-term perspective, because it's only through the long-term perspective that we build up the resilience needed.
Thank you for the valuable insights, Mr. Peterson. Moving on to get a field perspective is Ms. Zaina from the UNDP program in Yemen. Ms. Zaina, you have had a remarkable career with UNDP throughout the region, including work in some of the most challenging situations, where we see tens of millions of people that have been displaced, either due to conflict, natural or man-made disasters, or simply seeking a better life. As UNDP is a key institution on the ground, where many of these issues intersect, can you tell us a little more, please?
Thank you very much, Trude, and thank you for KS Relief, actually, for a very timely discussion, if I may say, on the humanitarian development nexus. And I say timely not only because of what we heard from the last session that was being discussed in terms of internal displacement, but because we see that conflicts around the world are increasing, both man-made and natural disasters. We see that they are becoming protracted. We see that they are becoming cyclical.
Sorry, Ms. Zaina, volume?
We see, is it better? Yes. Is it better?
Yes,
yeah, I
thank
think
you.
It's better. So we see that conflicts actually are increasing in intensity. We see that they are becoming protracted, they are becoming cyclical, and the effects that they have in terms of the development trajectory is humongous all over the world. Crises have also actually, and conflicts have resulted, as we have heard from the last session, in issues related to internal displacement. Over the last decade alone, we have seen a doubling in terms of internal displacement. And here I'm not talking about refugees. I'm talking about those who are internally displaced within their own countries. And as we've seen, there are many, many causes for internal displacement. It is either conflict, it's conflict over natural resources, it's lately climate-induced displacement, where, by the way, the World Bank is estimating that by 2050, more than 200 million people will be displaced around the world only because of climate-induced displacement. Here I have to note, very importantly, that displacement has a differentiated effect on different populations. The effect of displacement on women is different than those on men, on children, on youth, mostly on all vulnerable populations, and that has to be taken into consideration. So if we look at the humanitarian development peace agenda, we can look at the action agenda that was launched by the United Nations Secretary General to look at solutions to internal displacement, to protracted internal displacement. And it looks at three main pillars. One is to help those IDPs or internal displaced populations. Two, to work on the prevention agenda in terms of preventing internal displacement. And three is the protection agenda for those who are displaced. So this agenda, global agenda, is actually a translation of the humanitarian development peace nexus in action. And this continuum of the nexus should look at three things. The prevention agenda, which I honestly think that as an international community, we all fail to address. We address much more the response, which is the second pillar. And then what we need to look at is innovative development solutions to prevent displacement, to prevent conflict, to prevent crises. Any development solution has to be holistic, it has to be comprehensive, and it has to be integrated. And let me end by saying I'm a deep believer that without a prevention agenda and working on the root causes from the start, we will not be able really to tackle issues related to conflict and crises, and as a result, internal displacement.
Thank you for the thorough breakdown of the needs, Ms. Zana. Building on that, it's widely understood that UNDP works closely with the authorities, decision makers, governments, and the community to create and implement the projects that are locally owned and led and are sustainable. Can you go into a little more detail about what UNDP has done in the region and share some examples, good practices?
Being a field person, I've never worked in headquarters, I have to say. I've worked in all of the countries of the Arab region. But let me, Jude, share one success example of what we have done as UNDP with the international community in Iraq to look at what we call the funding facility for stabilization. And it is an exact operationalization of the humanitarian development and peace nexus, and it has been a huge success due to different reasons. If I look a little bit at the context, we all know that there was territorial control of ISIL, or so-called Daesh, in Iraq that took over around a fifth, even more, of the territory of the country, and ended up in displacing more than 6.5 million Iraqis out of their homes. There has been then, of course, the coalition to defeat ISIL, which was a coalition of a military coalition of international actors to defeat so-called Islamic State at that moment. However, the coalition also had a good cause and sense of civilian stabilization. So one arm was military stabilization, and the other arm was the civilian stabilization. Because the whole idea was, even if we liberate these areas, if we do not bring people back, it will not stabilize. So the whole stabilization agenda was implemented in Iraq. It was supported by a coalition of 30 partner countries, 30, which is humongous, to the order of around $1.5 billion. It is a success story in the sense that after 5 years or 6 years, it has resulted in the return of more than 5 million Iraqis back home through an integrated approach that looked, again, comprehensively at what would bring people back, but then keep them in their lands. So we worked on the rehabilitation of damaged infrastructure and services, schools, roads, health systems, water, sanitation, etc., to ensure that there is access to basic services for those returnees, while at the same time working on local economic development, so livelihoods creation for those who are returning. There was also a fourth pillar that we used to call a window of operation that also ensured that local security actors are also empowered to be able to provide rule of law and security for those who are coming back. And finally, cutting across the whole stabilization agenda was reconciliation and social cohesion. I have to say, we're very proud as UNDP to be leading on that with other actors, development actors, and the sister UN agencies. And it is a success story that I think we will learn from. As UNDP, we have been looking at the model, and now we are implementing it in Libya, we're implementing it in Mali, and in other countries around the world.
Thank you very much, Ms. Zana. Diving deeper into the region, we'll move to Mr. Ahmed, looking at perspective from GCC, specifically the Qatar charity. Mr. Ahmed, reflecting the humanitarian development and peace nexus collaborations on the ground, what are Qatar Charity's experiences and examples that you can highlight to us today?
Yeah, thank you very much, Jude. First of all, it's a pleasure to be here. And I'd like to thank King Salman Center for organizing this wonderful conference. I want to be a bit practical and give proper examples. My colleagues already highlighted crises being protracted and complex and so on. So in QC, we implemented 2 projects I believe can highlight the nexus in implementation. The first being in Darfur, after the peace treaty that was signed in Doha in 2011, Qatar Charity went in and implemented a project that included the complexes and addressed the water scarcity issue. So in that aspect, we addressed three main issues of the conflict primarily. The first was water scarcity. So we built water wells across Darfur that enabled access to water, eased tensions. The second was obviously reconstruction in the area. So we had 8 complexes, multidimensional complexes built to reintegrate IDPs. The third, obviously, is after building the trust with the community itself, we were able to convince them to come back and inhabit these complexes. The second example being in Malaysia, obviously it's a bit out of context of conflict. However, we went in after the generous donations of Qatar Fund for Development, where we're implementing health projects, education for the Rohingya refugees. It was at the request of the government. At the start of the project, QC implemented a basic humanitarian needs of health. We then built PHCs, mobile clinics, etc., for specifically Rohingya refugees. But throughout COVID, the government requested that they utilize these PHCs for Malaysians themselves. So that enabled the harmony between the two communities. Second of all, when it comes to education, at the beginning, we were requesting for the Malaysian curriculum to be utilized by the refugees. Now, after building the trust with the government and the local community, we're able to grant that. So I believe these two examples show us why the Nexus is needed. It's needed early in implementation. It can be planned, and jointly with our partners. So, for example, in the example of Malaysia, we very kindly requested from the UNHCR the proper PHCs, where to build them, and so on. So that shows also the collaboration on the ground.
Thank you, Mr. Ahmed. And then building on that, what could be done then to enhance our current approach to the triple nexus?
So if you allow me to be a bit critical and tangent on that side, I've been in the humanitarian field much less than my esteemed colleagues here. I've been about 5 years or so, and we're always talking about coordination in the humanitarian field. From my experience, I feel that the cluster level coordination is very good right now. However, the strategic level coordination is a bit lacking. If we take an example, the earthquake right now, or any other interventions, it feels like everyone is going in, and then we dive back and ask for coordination, etc. The second, obviously, that links to it is donor agencies demanding perhaps a development plan from implementing partners. And that could be done perhaps early at the phase. It could be done at the location level. Any kind of coordination in that sense also assists. Third, obviously, being we need to fix the root issues of the cause. So in the context of Darfur, we tried to build water wells to address the issues of the conflict. And if you allow me to also be a bit frank, it seems that usually INGOs and UN partners, etc., always try to go for the funding first and then the planning after. I don't want to be a bit too critical, but in that sense, I feel if we focus on the alliances and networks that we're in, so early in the earthquake, QC put out a statement addressing the humanitarian needs to Syria, but alliances and networks are there for that factor. So we didn't see alliances being properly implemented in that sense. There is no coalition that comes in early to discuss the needs, where are we located, who has access, etc. So I believe these three aspects will very much enhance the Nexus implementation.
Thank you for the critical insight, Mr. Ahmed.
Thank you.
Now to highlight to us the aspect from the highlighting the health systems is Dr. Adham Abdulmenam from the World Health Organization. Dr. Adham, you worked in different complex emergencies. And you also worked for years developing health systems in different countries. From your own experience, can you provide a clear example of how the triple nexus can be efficiently implemented in humanitarian settings?
Yes. First of all, thank you, Jude, for the question, and thank you for accepting me here on behalf of Dr. Rick Brennan, who's supposed to be here with us, but he's looking after emergencies, Syrian crisis, so real apologies. Let me start by saying that, as you mentioned, I spent maybe 10, 15 years of my life working on health systems,
which is basically developmental area of work, strengthening the healthcare services provided to citizens. But at the other side, I spent the last 6 years of my life operating in Iraq and Yemen, pure emergency operation that also required or got me a first-hand experience of seeing how the emergency part of business is done. And in all honesty, what I can tell you, since we're here sitting here to find answers, is that the situation to me looked like we are having two banks of a river, and we need a bridge between them, and that would be our nexus. On the one side, on the emergency part of the river, the donors, the stakeholders are looking for quick interventions. Of course, it's simpler and easier to respond to emergencies by throwing, in terms of health, emergency kits, trauma kits. Very quickly you can make an impact and show the value of your donation and investment. While, of course, on the other side, on the developmental, you need sustainability, and it takes time for you to realize the return on your investment. Nevertheless, that you need to build health information systems and other tangible things that will enable you to deliver. Between these two, there's numerous examples that I have seen and worked my background on development, injecting some of the developmental interventions into what we do. You'll be surprised, for all of you, to know that a classical example of nexus that we all overlooked was actually COVID-19. In the times where in your country you had a surge of cases, this is pure emergency operation, where we are all running after oxygen cylinders, trying to look for PCR machines and enough kits to operate. This is exactly what happens during a pandemic or an emergency. But then when the wave goes down, we as countries and UN agencies working there try to strengthen health systems by preparing ourselves for the next wave, trying to buy oxygen beds, ventilators, and so on, to empower the health system to be able to respond to the next wave. And between this push and pull, this is a classical example of how both can work together in rhythm to achieve the intended result. One of the big examples we have here is actually Saudi Arabia. Since I am taking over here as a country rep, Saudi Arabia did very well during COVID. But mind, and maybe the Saudis joining me here, some applications came out into existence, applications, digital apps, virtual hospital, virtual consultations that were developed for the emergency purposes, but with a mindset that they will have a life on its own that will extend and go beyond COVID. Now COVID restrictions are lifted, but still those applications are being used and developed more. The key here, Jude, is to think long-term, even during emergency settings. Instead of throwing trauma kits, think how to equip primary healthcare centers properly. Instead of relying on international NGOs, think of how to use local capacities, capacitate them to take over after we leave, and so on. So that's, I think, are some of the examples that I encountered and can be used as examples of the nexus and how both can work together.
Very interesting. And you just spoke about the two riverbanks and the need to develop the triple nexus as a bridge between them. Then can you provide a model that is capable of bringing development and humanitarian actors, donors together for a proper implementation of the triple nexus at the country level?
Thank you. That's a very, I've always thought about it. Working in Yemen, for example, I've always seen that we always mostly work with emergency donors. Developmental donors, you feel that they're waiting at the doorstep for them what's next. I think the best model is that, since we said we need a bridge between them, I think this bridge could be composed of 4 sectors. The first part, when we look at a country, we always do the mistake that if there is a man-made or natural disaster, we always think of this whole entire country as one emergency. That's not true. In many countries which we visited or worked at, there are some places at the front line of a conflict or at the place where the earthquake happened or whatever. This is pure emergency, 100%. We go in as emergency, we try to stop further deterioration of the situation, and that's the first part. But there are other places away from that, but being affected by that situation, where we have access issues there. We can still consider it as emergency, but we have to interject some developmental activities into it. For example, if you're away from the front line, but still you have access problem to areas or governorates that are affected, it is very simple that you can use local NGOs to still maintain hospital operations, to still inject some of your supplies, to provide essential health services in these places. It's very easy to do that. So there is a pure emergency operation. There is an emergency operation with small developmental interventions. And definitely there are places inside the same country where that do not feel the emergency, that are living normally. The citizens of these areas need normal services. So you think of a country as all emergency, which is actually on the ground, is not true. And for these people, yes, they are affected partially by emergency. They are affected by the economic conditions of the country, by the ongoing conflict, but still they need to live their daily normal routines. And in these kind of situations, developmental donors should play a role in maintaining essential services, in providing them in that context of some of the basics. So a model would be to, at the onset of emergency, we should break down the country into areas at the front line, 100% affected, partially affected, or non-affected by the emergency. That would be a good model to inject pure emergency donors here, pure developmental donors here, and a mixed hybrid model between the two where they can operate together. Thank you.
Very insightful. Thank you very much, Dr. Adham. Now to contextualize to us the SDGs and the triple nexus from the Kingdom of Saudi Arabia perspective is Ms. Yara from the Ministry of Economy and Planning. Ms. Yara, what are the major current and future efforts and steps that the Kingdom of Saudi Arabia is taking to ensure coherence in achieving the Sustainable and Development Goals?
Thank you, Jude. I think this is a very important question, and I believe that the Kingdom has took several steps and major key decisions to actually achieve sustainability. And we really do see that sustainability is within the heart of Vision 2030 since its inception. And recently, or actually a year ago, we have established the Sustainable Development Goals, the Sustainable Development Steering Committee, where 20 key government entities sits on the board and to oversee the full implementation of the SDGs. And through this committee, or the governance of this committee, we actually have an advisory board where we invite international organizations, private sector, and the civil society to start engaging on the several recommendations and policies that we are developing within this committee. And I believe this dynamic supported us to understand or get a little bit of a view of what is happening on a local level, as well as an international level, and connect these efforts together. So basically to ensure that we are really working and addressing the specific SDG challenges, the dynamic or the way that we approach this agenda is through shifting our thinking into a problem-based approach, and where we regularly highlight the major challenges that we're facing and try to collectively come up with different initiatives to address these challenges. And through this way, we are delivering on the Vision 2030 objectives or targets with a centerpiece of sustainability. And we are designing a lot of programs that are sustainability focused to cater to different levels within our community and different challenges locally and globally. The steering committee also works on mainstreaming the SDGs into policy making. And this is for the purpose of ensuring that we are really working on better well-being and quality life in Saudi, stronger economic prosperity and social development, as well as ensure environmental protection overall. And one of the major goals that we highlight as a key goal to address, which is the partnership goal, and I believe ODA efforts within the kingdom has really been significant to address the specific goal. So ODA is a major source of financing, and this is also really integral within the element of the SDGs. And Saudi Arabia, through its efforts and many related entities, we were able to build a more self-reliant, resilient, and peaceful societies. So the inception in April 2015 of the King Salman Humanitarian Aid and Relief Center as the country's humanitarian agency was a landmark step in the development of the kingdom's official development assistance, as well as the Saudi Development Fund, where there are a lot of several projects and development programs that has been really put into place, let's say. So KSA provides several categories of ODA, from humanitarian aid to development aid, like economic and social well-being for developing countries, and also charitable aid in the countries. So a lot of these initiatives really are strongly related to achieving specific objectives within the SDGs and to overall address the main targets within our Vision 2030.
Thank you very much, Ms. Yara, for the concrete examples. And then how does the Triple Nexus approach then support in achieving the SDGs?
So during the 2016 World Humanitarian Summit, I believe we collectively recognized that conflict is the main driver of the humanitarian need, and that the current systems are not sustainable, and we really need to collectively work together to make sure that we are accelerating into that achievement of sustainability. And KSA provided a lot of humanitarian development assistance of over 24 billion for different low-income countries as well as the middle-income countries. And what we really want to relate is how are we really addressing these specific issues when it comes to SDGs and the efforts that we're working on. So the Sustainable Development Goals and targets are really efforts to combat poverty, hunger, by limiting environmental degradation. And subsequently, this is done by promoting health, education, gender equality, decent work, economic growth, as well as providing clean water, strong global partnerships, and cooperation of peace and justice. So we need to strengthen our collective efforts to be more in sync rather than silo at a local level, national level, and internationally as well, by the different integral actors to provide specific solutions to address sustainability. And for example, one of the challenges globally that are currently being faced is education. And education transforms lives, and every generation should have better access to good education than the last, while ensuring that no one is left behind. And within the kingdom, we really try to put some quality in high-performing education systems that reflects our unique and diverse society. It is modern and responsive combination of traditional principles as well as innovation and creativity into fresh thinking. We focus on maximizing students' participation, progress and achievements, and responding to the identity and language and culture. We aim for a public education system that provides all Saudis with the lifelong learning opportunities so that they can discover and develop their full potential. We also address and continuously will address the gender equality specific issues, and we're really working on leading that and to be able to be more inclusive in our society. So I think There are so many different goals that we can really touch upon, and I believe there are a lot of achievements within the kingdom to really work on sustainability as well as from a humanitarian angle. Thank you, Jude.
Thank you for that comprehensive insights, Ms. Yara. Moving now, as we've heard a lot on fragile contexts and situations, we'll be moving to Mr. Giovanni from the International Office of Migration. Mr. Giovanni, fragile contexts present unique consideration when it comes to the fulfillment of the SDGs. Many have highlighted this in the panel. Why is this, and what can be done to move the dial on SDG achievements in such contexts?
Thank you, Jude, for the question, and thank you to KSC for organizing this event today. Let me just say that one of the principal promises of the SDG is to leave no one behind. However, when we look at the world around us, and we look at what's happening because of conflict and natural disasters, we must challenge ourselves and see where there are people that are actually being left behind. And if we look at the population of IDPs, internally displaced people, they really represent some of the most vulnerable people out there. They've lost their assets, they've lost their income, they've lost their houses, and they are now in a complete transition because their life has been disrupted. If you look at the numbers, we know that there's 60 million IDPs out there at the moment, and this is up as of 2021. If we add the displacement that happened in 2022, for example, the population of Ukraine, where we estimate a displacement of around 7 million, we are clearly moving up, possibly in the range, in a much bigger range. And no country is spared from displacement. If you look at some of the latest reports, 141 countries in 2021 were affected by displacement. A lot of displacement happens in fragile context. According to OECD, 80% of the displacement is in fragile context. And those countries are also receiving 95% of humanitarian aid, and they also host 70% of the world extreme poor people. So clearly, if we don't work on that specific population, the displaced, there's going to be an impact on the SDG, a very, very significant impact on the SDGs. If we look at the countries hosting IDPs, in 50% of them, the SDGs are going in the wrong direction. So one of the tools that was developed recently, and my colleague Zaina just mentioned it, is the Secretary General's Action Agenda, which is really an effort to change the way we look at this issue. And the agenda says very clearly at its inception that more of the same is not good enough. And displacement cannot be solved with humanitarian tools alone. Actors across the spectrum, and I'm talking humanitarian, development, but also peace, disaster reduction, climate actors should join forces to tackle this challenge. If we can solve displacement, if we can bring those people to a leveled playing field with their host communities, then there's hopes that the track towards achieving SDGs can be achieved. The Secretary General Action Agenda really represents a roadmap to get there, to bring together all those actors, and really to focus on several kind of key elements to get to that point. One is to ensure that there's a strong government leadership. The government has to be in the driving seat of this exercise. There has to be a better organized international community in support of the government to set up all the necessary kind of systems to provide this support for the government. And there has to be a concerted effort to develop a solution strategy with all the actors involved so that there's a common goal, a collective action that needs to be achieved on this matter. And then, of course, it's important to mobilize the right financial resources And here we're talking beyond humanitarian. We're talking development financing. We're talking IFI financing. And I think that's the direction of travel that hopefully we will get once this all durable solution action agenda is set in motion. Thank you.
Thank you, Mr. Giovanni. Then, building also on that, how can an access-based approach be used to turn the current challenge displacement poses into a catalyst for the achievement of SDGs in fragile contexts?
Yeah, as I said before, I think we need to move on from an approach that really focused on accompanying displacement to a process that really looks at solving displacement from the start. And really, only one way to do this is to work on prevention, as was mentioned before, so reduce displacement to start with, reduce the numbers, then do a better work when we provide a humanitarian response, thinking of solutions from the start, including that since the beginning, and this was mentioned by colleagues before me. And then, of course, focusing on solutions. Very often we leave the solutions to the future, to uncertain actors. Well, we should all collaborate to bring this change forward. And that's how we should all operate after the adoption of this action agenda. We need to look at a very integrated, holistic approach, so really utilizing the nexus from the start. And try to insert all of the elements coming from different sides of the house, different expertises across the UN and beyond the UN to achieve those goals. I want to mention a couple of examples of how IOM, my organization, the International Organization for Migration, is trying to change the approach towards displacement. For example, when it comes to data, I think we have a very solid data collection tool. We call it the Displacement Tracking Matrix. You will hear about it tomorrow, actually. This is a repository of data, primary data on displacement. And for example, over the course of last year, it was able to monitor 39 million IDPs around the world and 26 million returnees in 80 countries. Now, the DTM, which has historically been focused on tracking displacement, is really trying to look at ways in which it can expand this focus and open up to better prevention, working on prevention numbers, and also on solutions, how to help the actors that are working on solutions find the right information to support the process. Another example of how IOM is working on these matters is in South Sudan, where together with the World Bank, the organization is working on a major infrastructure project that is really focusing on building small and medium-scale infrastructure together with governance to prevent further displacement or to protect displaced people from flooding, from recurring events. So this is a very successful, for example, approach that the organization is trying to put together. And maybe finally, I would conclude with an example from Ukraine, which is an example of how the organization is really trying with other actors, other sister UN agencies, to step up durable solutions even during an active conflict. So the colleagues on the ground have chosen two separate locations, one in which people have returned and are restarting their lives, and one in which people are locally integrated because they don't see any option to return back home. And these two pilots are going to be very critical because it's in those contexts that tools will be tested, approaches will be used in the context and adapted to the context of Ukraine to really kickstart the durable solution process and be ready for when bigger scale returns can take place. So in conclusion, I just want to say that if we manage to resolve displacement with this new approach, if we manage to tackle it earlier on, then member states will be in a better position to achieve the SDGs and go back to their developmental pathway. Thank you.
Thank you for that comprehensive and holistic answer, Mr. Giovanni. And now moving to Dr. Hakim from the Food and Agriculture Organization. FAO is mandated to lead on food systems transformation. Where does it see its leadership in terms of the triple nexus?
Thank you, Jude, and good afternoon to everyone, and thanks to Case Relief for having this opportunity. Food is one of the sectors that, of course, highly impacted by conflicts. And you mentioned about the FAO's leadership in driving the nexus. Now, maybe we need to take a step back and think about, what has motivated the whole idea of the nexus. There is this old thought about you cannot have peace if you don't have development in place. But you cannot progress with development if you don't have peace. And then humanitarian aids came in as a way to shift people from the state of no peace or conflict into starting the development progress. And this is where the link comes in. FAO started a pilot program on developing what we know today as IPC, which is the Integrated Phase Classification. It's an important framework that's used today by most of the international donors to identify which categories and communities that require immediate humanitarian assistance and where the development assistance is needed. Very important that the IPC, the Integrated Phase Classification, which looks at acute food insecurity, chronic food insecurity, and acute malnutrition, and classifies them into what we know today as 5 categories or phases, from no food insecurity issues, to stressed communities, to communities in crisis, and then to communities in emergency, leading to 5, which is the catastrophic situation that leads to famine. These are essential because they will allow and inform the decision-making institutions, organizations, as well as donor communities to identify which of the community affected, let's say in Yemen, how much is the percentage that needs immediate humanitarian assistance in terms of food, and how much that would need development. But the other important aspect where the FAO roles comes in as a leadership is to avoid more of those who are on the low phase categories to move to the other phase if the conflict protracts as what we see today. The agri-food systems, as we refer to them in FAO, are built around a number of aspects, including local value chains. And FAO works and have many examples on developing and promoting the local value chains for the communities, affected communities. And I've heard some interesting interventions from the colleagues here, our colleague from UNDP in Yemen, and the other interventions also from WHO, identifies that it's not the whole community affected equally in a conflict situation. There are always people on the front line, and that's where the IPC classification comes in and tells us that these people in this region, they're well, that's where you can invest more on development, and there is more immediate need in crisis situation. Now, what we try to do is that we try to benefit from that classification in a scientific way to identify where we can promote people so that we also reduce IDPs. So we allow people to come in and remain in their lands. And we have recent examples of in Syria, in Sudan, in Yemen, where the efforts that are led by FAO in promoting agriculture, sustainable agriculture for the rural communities, to come back to their lands, not only to settle in the lands, but also contribute to produce food for the remaining of the community. And that's very important for sustaining the peace nexus vis-a-vis the development and reduce the demand on a humanitarian. So keep the nexus as part of the strategic framework. The FAO strategic framework that aims to build a resilient and efficient and sustainable agri-food systems with better nutrition, better production, better environment, and better life, leaving no one behind, informs all the programs and the projects FAO undertakes in conflict and non-conflict situations. And that is informed very well by the nexus, because when we think of better production, it's basically maximizing the production, but also keeping better life and better environment. That's where the peace aspect comes in, and that is where our major programs, especially the regional priorities, inform all the interventions that we do. A very important pillar of our regional interventions is resilience building program, and we believe very much that investment in resilience has a high return on investment. In a recent study that the FAO did in Sudan specifically, $1 spent on building resilience through early warning and anticipatory actions saves up to $7 of avoided losses to the communities by investing on resilience. Another similar situation that was carried out in Syria recently, and that's against development and humanitarian, that $1 spent on development will save $5 on spending on a humanitarian. And that's very important. And this nexus will always allow us to move, because we cannot avoid having people under crisis situation, and we need an immediate humanitarian intervention. However, we need to bear in mind that this must have a time limit where we shift immediately people to sustain them into a more development situation by engaging them into carrying out their normal duties, especially when it comes to agriculture. One last point is that we bear in mind in our region we have more than 60% of total populations live in rural areas and practice agriculture as the main job. So these are the highest number of people affected by most of the crisis. And the other aspect that is extremely also sensitive in this regard is that this community needs sustainability for them to provide food for the rest of the communities that are living in the cities or by the cities. So that is where FAO takes the lead in providing real data and analysis based on scientific framework that informs all the organizations. Today, 15 organizations join us in the IPC as a reference for identifying people under humanitarian need or development need, and use that as a model that would inform the decision makers in terms of response and providing resources.
Thank you, Doctor. And Dr. Hakim, pivoting on that, since you have highlighted development, then considering in terms of future thinking, and FAO's unique focus to end hunger and malnutrition, what are future steps that it will take to follow up to that SDGs?
I mentioned the FAO strategic framework, which starts 2022 to 2031, and it is to achieve the Agenda 2030 of the SDGs by transforming the agri-food systems to be more efficient and more resilient and more sustainable through what we identified earlier, we call them the four betters, the four production, better nutrition, better environment, and better life. And this structure informs all our future activities in supporting the partnership as well as in our programs and projects at the regional, at the country level. A very important aspect that we think that we've managed to succeed and build on the future leadership is the partnership aspect under SDG 17, working with the other sister agencies, but also with the local communities. A very good example, our work with IOM in Yemen, where the local dispute over land and water has resulted in people not being able to use water resources like Al-Malaka Dam. And it was FAO's and IOM efforts that managed to reach an agreement among the local communities through the establishment of the water users associations. And this is the local communities who manage their own water resources. So they allow them to have access to the natural resources, mainly water and land, and be able to reach an agreement. An interesting development here is that we engaged women into leading what we call the Women Water Users Association to manage the water and be part to mainstream gender as well in the community. A similar practice was followed recently in Syria, where the locals has established Water Users Association and were able to use the water. Of course, this is complemented with future projects like building the waterways and the canals and the local storage facilities. But without this, you cannot have sustainability of about 8 million Syrians that we've managed to bring them back to their lands and be able to contribute to their local development. Now, going ahead with the future, we believe very much that our strategic framework built around the four betters will drive the way forward in achieving the SDGs. with a focus not only on SDG 16 when we talk about the nexus, because that's where the peace, governance, and institutions comes in, but it's actually affecting all the other SDGs. The hunger, the health, the education, and all the others have to come in interacting so that we can move quickly into going back to track to achieve the SDGs.
Thank you very much, Dr. Hakim. Now, opening up the Q&A to the audience, please, if you do have a question, raise your hand, say your name and title, and indicate who it's directed at.
No questions.
I see a hand over there. I see 2 hands. I think the mic will be coming in a second.
We need to congratulate the
If
moderator.
you can keep your hand raised, please, miss. Thank you. Okay, I see 3 hands.
I think this is the first session where we have participation, right?
3 questions.
Bismillah ar-Rahman ar-Rahim. Good afternoon, everybody. Thank you for this nice conference. First of all, I would like to thank you for this nice conference, and I would like to introduce myself. My name is Hanan Bahmed. I'm from Mukalla. I am a team leader for Women Association. Also, I am a gender consultant. Actually, we came here with very hard circumstances, and I would like to give you some picture about gender in Yemen. We have a lot of challenge, and we are suffering to give our voice for 5 years. Finally, we can come, me and my assistants, Mrs. Mariam Al-Bahsani. So I would love to tell you about, we have done many research about violence against women. We have 700 women. We're doing research about the violence in Yemen. And we have also many activities for IDPs. And actually, I love the conference, but it was too late to give some presentation about ourselves, and I would love if we could find somebody to do the presentation about our situation in Mukalla Hadramaut. Thank you for your listening.
I think there was also someone right behind you that had their hands raised as well. Someone else. في واحدة وراها. Okay. شكراً.
شكراً جزيلاً. زعفران زايد من منظمات المجتمع المدني اليمنية أيضاً. كنت أتمنى أن أتدخل في الموضوع الأول فيما يتعلق بالآليات والقانون الدولي الإنساني، لأنه من الملاحظ يعني للأسف لا يوجد أي تطور بالنسبة لمكاتب الأمم المتحدة يعني في التعامل في القضايا الإنسانية. سيست كثير من القضايا خصوصا فيما يتعلق باليمن. تحدثتم كثيرا عن النازحين وعن المهاجرين، ولكن لم أجد من يتحدث عن المهجرين قسرا. نحن في اليمن لدينا أكثر من 1000 بيت تم تفجيره من قبل الميليشيات الحوثية، وهجر أهل هؤلاء البيوت قسرا إلى مخيمات النازحين. طبعا تعاني كثير من النساء والأطفال من آثار هذا التهجير وأيضا النزوح. لدينا أكثر من 2 مليون نازح، وهنالك قصور كبير جدا لمكاتب الأمم المتحدة في اليمن وفي عملها. تكاد تكون محصورة في المناطق التي تسيطر عليها الميليشيات الحوثية. وجودها في المناطق المحررة والمناطق التي تستوعب كثير من هؤلاء النازحين تكاد تكون بسيطة جدا، تدخلاتها بسيطة جدا، لا ترتقي أيضا إلى مستوى الاحتياجات الحقيقية، مع وجود كثير من المعاناة في اليمن خصوصا ما يتعلق بالنساء والأطفال. الشراكة أيضا الشراكة مع المجتمع المحلي والمجتمع المدني ما تزال كما هي من قبل تقريبا 20 سنة. نفس الشركاء، نفس أيضا تدار كثير من عمليات الفساد وغسل الأموال. أيضا هنالك نقطة مهمة جدا، للأسف مكاتب الأمم المتحدة لديها كثير من المخصصات التشغيلية تكاد توصل إلى 40% من نسبة المنح الإنسانية المقدمة لليمن، رغم أن هنالك ما يقارب أكثر من 34 مليون دولار مقدمة لليمن أو مليار، ولكن مع ذلك تفاقم الوضع الإنساني في اليمن. أصبحنا نرى اليمنيين داخل العاصمة صنعاء وفي كل المناطق التي تسيطر عليها الميليشيات يأكلون من حاويات القمامة، يسكنون في الشوارع. يعني الميليشيات أيضا تمنع الرواتب، رغم أن هنالك كانت في اتفاقية ستوكهولم أن عائدات وبإشراف أيضا مكاتب الأمم المتحدة أن تكون عائدات النفط وعائدات ميناء الحديدة لدفع مرتبات الموظفين في اليمن. إلى الآن 8 سنوات واليمنيين بدون رواتب.
نركز على الأسئلة لو سمحتي الموجهة للمتحدثين على موضوع الأهداف التنمية وعلى موضوع النكسس لبناء السلام والتطوير. أشكرك، بس حاليا نبغى من الوقت الصراحة قصير.
بناء السلام عندما لا يكون
نركز على بعض الأسئلة الموجودة، فشكرا لك.
كيف سيكون هنالك
في
بناء
شخصين
سلام مع
بعد
وجود
نبغى
أكثر
نعطيهم
من
فرصة
2 مليون
السؤال.
نازح ومهجر. 2 مليون نازح ومهجر. إذا لم يكن هنالك معالجات كثيرة
الوقت
من
عندنا
المشكلات،
قصير ونبغى نركز على الأسئلة الموجهة للمتحدثين. Please everyone, with the time limit we have, let's focus our questions on the session and what our panelists were able to share with us today in terms of insights, good practices, and lessons learned. I think we have time now to just take 2 questions. And as I said, please keep it brief so that we can really give our attention and time to the answers. لو سمحتم لكم جميعاً الأسئلة اللي تشاركوها معنا اليوم تكون مركزة على المتحدثين عن الموضوع تناقشنا له اليوم. عندنا بسبب الوقت يمكن وقت ناخذ سؤال أو سؤالين. شكراً لكم. Please, Miss, go ahead. Thank you very much.
Hi, thank you. My name is Marta Valdez. I'm Oxfam Humanitarian Director, and I'm the co-chair of a global group in the Interagency Standing Committee on the Nexus. I wanted to ask a question to Madame Sena Ali Ahmad from Yemen, as well as to Rasad Abdel Monaim. But in any case, it can be answered from any of the panel members. Thank you for the views. One of the challenges that we find quite often is that in the context where conflict is protracted, development actors have a different risk tolerance. And therefore, it is quite difficult to speak about the nexus because the humanitarian colleagues, they take a big load. So we'd like to hear from your experience any case where development actors have managed to develop a different type of risk tolerance and therefore be more present and proactive in conflict setting. Thank you.
Thank you. And I think we have time for one last question, and I saw someone raise his hands. واحدة هنا لو سمحت، آخر سؤال. تسمحين لو سمحتي ترفعين يدك بس عشان شكراً.
مساء الخير، اسمي حصة الثاني، مبعوث الأمين العام لجامعة الدول العربية للإغاثة الإنسانية. شكرا لجميع المتحدثين على ما أثروه من نقاط مهمة، ومنذ بداية اليوم ونحن نستمع لتلك المداخلات الهامة. سؤالي باختصار بالنسبة لتريبل نكسس، كيف تم تطبيقه مع مفهوم الاستجابة المحلية localization response؟ هذا بالنسبة للمواطنين داخل المجتمعات المحلية. موضوع بناء السلام مفهوم كثير على مستوى القاعات والمؤتمرات والفعاليات وفي كل مكان وعلى كل المستويات. كذلك في بعض المجتمعات المحلية نعرف أنه تم تطبيقه وتم النجاح فيه، ولكن بودي أن أسمع من المتحدثين كيف تم تطبيقه من خلال الاستجابة المحلية للمجتمعات المحلية. شكراً.
شكرا لك. I'll translate that one. So her question was really that in terms of peace building, and we can take it in our context, the triple nexus, the humanitarian development piece, is really well understood in terms of on the level of academics, forums, conferences. But then when it comes to الاستجابة المحلية, and that's really the local response, what have you seen in taking that on locally? And if there's any good practices or examples that you can share, and I leave that open to whichever panelist that would like to take. Maybe first, Ms. Zaina, in case you'd like to respond to the question.
Thank you very much,
Thank
Shud.
you.
And I was saying we need to congratulate you as moderator, first for the timekeeping, but second for opening the floor. Thank you very much for the questions. To the colleague in terms of Yemen, I will not speak about Yemen, but I will speak about the risk tolerance of my own organization. And I totally agree. Development organizations are by nature more risk averse, if we may say so. However, during the last few years, I have to say, at least from UNDP's perspective, embracing the agenda of the humanitarian development peace nexus has made us an organization that is a bit more open to be an embracing of uncertainty, if I may say so, and peace. And the proof is that UNDP used to wait, I think, years ago, decades ago, until the humanitarian program is finalized and crisis is over to put feet on the ground. Now we actually advocate for this continuum between the humanitarian and peace and development nexus, because our conceptual framework, our understanding, and because of, I have to say, the lessons learned working all around the world, has indicated that you cannot wait. First, the world cannot wait. Second, the prevention agenda has to prevail. We need to look, as Giovanni had said, most of the crises, for example, are in fragile countries, right? And if we continue to work on response only, without looking at recovery strategies, but also without looking at prevention and resilience building, as our colleague from FAO had indicated, this, if there's anything, these are lessons learned going forward. So I think that at least from the UNDP side, we have been able to embrace uncertainty, and the whole world, if I may say, with a new world order that is governed by uncertainty. So you see us working in Afghanistan, you see us working still in Syria, in Yemen, in Iraq, etc. In terms of, there was another question on the localization. Maybe, Jude, if I have time, I can give a small example on the localization, or we give to the other panel members, as you wish.
If you'd like to add a point, but we'd also really love to hear from our other panelists on localization as well.
Maybe very quickly on the localization agenda, we worked very much with other UN agencies, especially IOM, on a program on the return and reintegration of ISIL perceived affiliated families. These are families where one member of the family had been perceived to be affiliated with the so-called ISIL militia. So at that time, we worked on local solutions of how to mainstream reintegration into the local agendas through a combination of a comprehensive integrated approaches, working from the local solutions themselves and working on the acceptance by local communities to what they believe as their own grievances. But we can discuss that example more. Thank you.
Thank you, Ms. Zainab.
I think something was directed to me, right?
Please go ahead, Dr.
Yeah, I mean, first of all, let me say that in the most, I mean, you all know in the Chinese yin-yang, in the most developed country, there's a chance of an emergency happening. And look at what's happening now in Turkey out of the blues. And on vice versa, in the most emergency country, developmental activities do happen. And between this and that, there's actually, as I said, a model that could be employed that takes into account risk, the likelihood of risk, the impact of risk. And the way we look at it in WHO is that our interventions should not be uniform across the country, depending on the level of emergency inside that country and the stability and the access that our staff can access and provide the services, but our interventions also rely on a risk model. And if we found, even in the worst cases, if we found that the risk is high, there are methods for risk aversion or employing someone on our behalf in the most affected and risky areas to deliver the service. So yes, we take risk into account, we look into the likelihood of risk, the impact of risk, and we do at the end employ that into our calculated steps in providing the essential interventions, either directly through us, or through a proxy, or through someone whom we can communicate with in terms of ensuring at least that partially the services is provided. About localization and local communities, I think there's a session looking into local communities and how their engagement could make an impact. And not to take much of your time, I think we refer that question to them. They're more prepared to answer such that, but as Zaina said, we do consider that as part of our delivery to the services in humanitarian settings, local communities, localization, to achieve the peace. And maybe the peace is the least word we spoke about today. Peace can never be achieved unless every citizen feels just and trust services, good economic conditions, and stoppage of conflict is happening in the area he's living in. And all of these, if you put them in the mixer, means that citizen should be getting good health, goes to good school, provide good working conditions and labor conditions, good environmental packages. So peace, to achieve the peace nexus, you have to really do well on the humanitarian, developmental, to achieve that peace through the local communities. So this is what I wanted to say. Thank you.
Thank you, Dr. Appam. And to further elaborate on operationalization, the triple nexus and localization, please, ASG Peterson.
Thank you. And I would also like to welcome that we have the possibility of having questions from colleagues sitting out there. In particular, I also welcome that we heard voices from some of them that are impacted in their daily life. So really appreciate that. And to the first question, from Yemen, it was more a statement, and whether we could have a session on Yemen, that's not up to me, but I would love that, but there might be some other time. But the issue of working for women, in particular providing support for victims of violence and also ensuring maternal health care is something that we are working through our local partners in very much in Yemen, and I can't promise money from here, but I'll definitely promise that I will talk to my colleagues in the country office and also follow up. It brings focus on a point which is always difficult, both in the longer term development work, so to speak, but also in very acute responses. It is difficult to mobilize funding for women organizations and women process and gender equality. There was an upsurge after the events in Afghanistan, Taliban takeover, but otherwise it's very difficult. And it's very ironic in a way, because we also know it's the best investment we can almost do in long-term resilience and development is to invest in women's health, in women's education, girls' education, have them involved in the local things. So let's focus on that in the way ahead of us. That's an important part of the nexus, I would say, because it goes both ways. Let me just touch on two other points that were mentioned here. Nexus at the local level, the localization. We have actually, and I think I mentioned it, we work a lot through a local organization, in particular women-led organization. We have also, for instance, in Tigray, worked with mobilizing, recruiting, in this case, women midwives among the IDPs and the refugees, and assisting them in forming clinics with services for the women in these areas, and also for the IDPs. So you kind of build up capacity and also provide the services at the same time at the local level. with people and provided by women who have the local knowledge of what is actually the most pressing needs of women here. So that's something that we definitely would like to work on. And it requires that there is sometimes also a risk willingness to engage in corporations like this, but they also pay off quite well. And then just the last point from my side to the question of government actors and how examples of how they're working. I used to represent the government for many years, so maybe not the right to act, but I do think there's been a chance or a trend there also since the Humanitarian Summit. But I do also think that for many years, the discussion, conversation around the nexus in the beginning, the development, humanitarian nexus, and now the peace nexus, the peace as well, has been taking place within the humanitarian setting and within the development setting. And I always, wonder a little bit when asked and when hearing this conversation, because as I also said in the beginning, I consider myself representing both as this organization. So we need to work on that. And that also goes to the flexibility in how we address, we talked about funding earlier, financing. I had a conversation with a donor representative this morning. They have now, for the civil society organization they're supporting, put all the funding together in one pool, both humanitarian, what used to be humanitarian, what used to be development, and then it's left to the organization to provide, of course, live up to the results achieved, agreed, but also being able to respond very quickly in terms of crisis, but also when the crisis fades out, and we need to get into a more development mode again, which has happened luckily many times. And hopefully that will come to UN organizations as well. But these are some of the things that we need to see. Thanks.
Thank you very much, Mr. Peterson. Would you like to further add, please?
Yeah, I think it's on the risk appetite for development organizations in conflict situations. We have to see the learning curve for these organizations, which is based on data, analytics, and the evidence that is developed over the years and decades. I recall over 20 years ago, I had a meeting with someone senior at the World Bank at that time, and we said we want to do this and that in a conflict country in Africa. And they immediately responded, our policy, if there is a conflict, there is no intervention. And this is a development institution. Today in Yemen, for FAO, the biggest donor and contributor is the World Bank. And they've completely changed the risk appetite into promoting development in conflict situations, where it allows also to sustain the peace. Because if you're not working on those areas that are not directly affected by the conflict, you are actually encouraging more to be engaged in the conflict itself instead of giving them more sustainable livelihood so that they keep away and speed up the peace process. So same for most of the UN agencies. They're almost around in all the conflict countries and try as much as possible to control and manage the risks so that they can continue provide support to the remaining community. Thank you.
Thank you very much, and thank you for the audience's engagement. Due to the time frame we have, I'll have to conclude the Q&A here. Moving on then to wrap up this session, I'd just like to conclude with 3 recommendations that really emphasizes the keywords and key ideas that were presented to us by the distinguished panelists. And that's really to first better promote the interlinkages between humanitarian development and peace approaches to achieve a comprehensive and sustainable peace. To also strengthen the complementarity between the humanitarian action and the Agenda 2030 for the Sustainable Development Goals. And finally, to emphasize the importance of a holistic and comprehensive approach that links the humanitarian action, development, and peace efforts, particularly taking into account the different contexts there are to fragility in a country to achieve the Sustainable Development Goals, hopefully by 2030. Please all join me in applauding our distinguished panelists for their contribution today, and thank you all very much.
Very good. Yes. Thank you.